welcome to Aortic Hope Week in Review. I am Rob Seltzer, presenting our today's program. Aortic Hope, which connects hearts one beat at a time. Our mission of spreading hope, creating awareness, and providing support brings this program to you. While you are on the YouTube, please take a look and like and subscribe to the program so you're always reminded when we are on AHTV. And there's also a donate button where you can make a donation. We are a 501c3 that is run totally by volunteers who are survivors of aortic disease, dissections, aneurysms, and valve disease. So we can only bring this to you with donations. Any amount, want to donate $1 and on up, we appreciate every single penny. Well, I'm here on the Aortic Hope homepage, which is aortichope.org. This is where you can also find our patient guides for aortic disease. They are free to you and to the medical profession. You can download them, or you can go down to the book. This is the aortic disease. This is for people with aneurysms and valve disease. And this is where your doctors and hospitals can order bulk. You can order a single copy for your home, take a survey, or you can also go to YouTube here, not to YouTube, I'm sorry. This will redirect you to a PDF file which you can download for free. And also you can find it on AHTV where you can watch it on YouTube. And there is also the original aortic dissection patient guide with the same programming. You can download it for free. There is a YouTube playlist, and you can order bulk hard copy and for yourself. Okay, and the survey. This one is available in both English and Spanish for our Spanish-speaking friends and members of our community. So we are going to talk today about the articles that are in our blog from January 26th through January 31st. The blog is right here. You can read these articles when I am done by going to aortichope.org and clicking on the blog. And you will see the articles just like this. There they are. There is our blog. So let's start with last Monday. It is Medical Monday. And you should be aware it's cold and flu season. This is always in the winter. We have lots of colds and flu as we spend more time inside and more time with other people inside. And that is a problem. So because we can catch a lot of things, viruses and infections do get passed around when we're all inside close together. So what can we do to beat the cold and flu season? So first, let's talk about how they affect us, because these are more dangerous for people with aortic disease, especially certain viruses, which include influenza or the flu and COVID-19. They will trigger inflammatory responses in the body. In some cases, this inflammation may involve structures near or within the heart, including pleuritis, inflammation of the lining of the lungs, often causing sharp chest pain that worsens with breathing, pericarditis, inflammation of the sac surrounding the heart, which may cause chest pain that changes with position, which is no fun. I've had that one. And myocarditis, inflammation of the heart muscle itself, which can affect heart function and lead to fatigue, shortness of breath, or irregular heartbeats. Very important that you know these things and that you look for the symptoms. They can be mild and just go away on their own. However, some patients with underlying comorbidities or cardiovascular disease prompt evaluation is important. Always see your physician or talk to them, or even an urgent care if you need to. Let's talk about the symptoms. Chest discomfort, fatigue, shortness of breath. They can sometimes be thought of just being sick, right? But for individuals with aortic conditions, it's especially important to seek medical advice if symptoms are new, worsening, or feel different from prior illnesses. Chest pain, unexplained shortness of breath, palpitations, or significant weakness should not be ignored, ever, not even when you're sick. If we have those symptoms, when uncertain, contacting your healthcare provider is a prudent step. Most likely, they're going to tell you, we know what they're going to say, go to the ER. None of us like going to the ER. We've been there too many times, but we have to. We need to because of aortic disease. So it's very important to protect ourselves and do what is necessary. So, how do we reduce our risk during flu season? We can take preventative measures, which include follow your healthcare provider's recommendations for regarding vaccinations. They are important. They may not prevent you getting sick, but they will lessen the strength of the illness, and it should be not last as long as well. So there are good reasons to take them, and if your provider tells you because of our complications, you should do that. Practice good hand hygiene and avoid close contact with those who are ill. So, if people are sick, and they do go out when they're sick, we know that during this time of year, you go to a movie, there's people coughing and sneezing and all sorts of things just because they want to see that movie. Sharing, which is not caring in that sense. So, if you do, we want to practice good hand hygiene because your hands are major carriers. Washing our hands properly is the number one prevention for passing on disease and for catching disease from surfaces and other people. Now, make sure when you do wash your hands that you follow the method that's been prescribed internationally by the World Health Organization and the NIH, which is you want to wash your hands for 20 seconds. All right, so we sing happy birthday twice or the ABCs to ourselves while we do it. Wet your hands, put soap on them, enough to lather, 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 then between the fingers, washing on top of your hand, and then switch and wash on the other between your fingers. Get your thumbs, get your nails, rub your fingertips and your nails on your palm. That helps wash the palm and clean from underneath your fingernails, both sides again. Then wash, 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 wash. And when we're done singing that song in our mind, rinse, you left the water running, rinse off your hands, grab a towel, hopefully disposable, dry your hands, and then use the towel to turn off the water. Don't use your hands because now you're just going to recontaminate them. Okay? Very simple. There's lots of videos out there if you want to watch it or just you want to show your kids or anybody else about doing that. Now, if you do get sick, allow adequate rest and recovery time during the illness and keep your important medical information and emergency contacts readily available. So, as you know, most viral infections do not lead to serious cardiac complications, but in being aware what can happen is meant to empower you and not alarm you, but make you, being advised, be well advised. Stay informed, listen to your body, and seek care when needed are the key components of protecting your health. So thank you, Satya, one of our medical students, for preparing this for us. Let's go to Topic Tuesday. Oh, more winter. Boy, it brings lots of things. So it's been a cold winter. I know that. Where I'm at, it's been as much as 20 below zero the last couple of weeks. So it's been very, very cold. But what you may not know is that there is an association between cold and aortic dissections. Link between, we have temperatures, blood pressure, and aortic dissection. See that? Now, let's just review real quick. Aortic dissection happens inside your aorta, which is the main blood vessel that carries oxygen-rich blood from the heart to the rest of your body. It's really big. It's like a garden hose. Aortic dissection happens when a tear develops on the inside of the aortic wall, causing blood to flow between those layers and separate them, which is not good. Several studies have shown that higher rates of aortic dissections happen during the winter months. I didn't know that. That's new to me and good to know. So why are they more common during winter? Well, it's really a pretty simple answer. When we're exposed to cold weather, we try to conserve heat, right? And our body does that by narrowing our blood vessels through a process called vasoconstriction, which is the opposite of vasodilation, which many of us take blood pressure meds that are vasodilators, right? They expand the aorta and the blood vessels. Well, vasoconstriction is bad because when you make the pipe smaller, the heart has to push harder to move the blood, so it raises our blood pressure. That is not good. So pushes against the walls, which can increase an aneurysm or even cause a rupture or an aortic dissection. Repeated or sustained increases in blood pressure make weakened areas of the aorta more likely to tear. So you have to be careful when we go outside in the very, very cold. Now, if you think you're having a dissection, the warning signs, the symptoms would include sudden severe chest pain or upper back pain, often described as tearing or ripping. I can vouch for that one. Pain that moves to the neck, jaw, or abdomen, shortness of breath, and fainting or dizziness. If you or a loved one experience any of these, call 911 and seek medical care immediately. None of us want to go to the hospital, but this happens. We have no other choice, okay? We just have to do it. How can you reduce your risk? Stay warm, avoid prolonged exposure to cold. So by staying warm, lots of layers. Wear plenty of clothing and in layers. Multiple layers will help keep you warm. Monitor your blood pressure regularly. Take all your medications as prescribed. Do not smoke. That's bad news. Avoid sudden exertion in the cold. So no shoveling or heavy lifting because those can cause sudden blood pressure spikes and increase the risk of dissections. Spikes are what's really bad for us. Slow and even increases in blood pressure are easier for your aorta to handle. That's why when we exercise, we do a warm up to slowly bring up our blood pressure. Shoveling, heavy lifting, and twisting can cause your blood pressure to go from 110 to 200 in a matter of seconds. So those type of spikes, if you notice, like this, boom, really stretching out your aorta and can cause a problem. So that's why we're told not to do those things. So it's very important during the winter to be aware of the winter, of the cold and what's happening. Understand how this cold can affect us and take steps. Be proactive. Protect your health. We are committed to education, support, and empowering you with the knowledge needed to stay safe through every season here at Aortic Hope. And I want to thank Kiana Zahiri, our Brown medical student, who wrote this article for us, which you can again find up here on our blog. So what's next? Oh, it's Survivor Series Saturday featuring Rob Blumenthal. Shout out to Rob. Thank you so much for sharing your story for us, Survivor Series. Our stories from survivors of aortic dissection, aneurysms, ruptures, valve disease, all those things. And they can be very inspiring and make us feel not alone, seeing that other people have gone through the same thing that we have. And everyone can share their story if they wish. We want you to do it and help inspire someone else and help them through their recovery. So you can do that by clicking right here on that page. If you want to join the Survivor Series, click here and you can do a video or you can just do a written version like Rob did. And if you've done one before, after about 3-4 years, we'd like to hear from you again and do the Where Are They Now? Click here to do that. So Rob's story, my journey with a bicuspid aortic valve, why self-advocacy saved my life. Great story. And again, thank you, Rob, for taking the time to do this for us and the members of our community. Well, this isn't last week, it's this week, but it's so important. February is National Heart Health Month, and Aortic Hope is celebrating that, and we'll be making posts and articles and so on all month about National Heart Health Month, especially focused on aortic disease and aortic valve disease. So love your heart and aorta. Learn more about keeping it healthy, you see. We are a board of volunteers. Remember that. All of us are survivors and volunteers, 9 members on the board of directors, and more than 30 ambassadors across the country and Canada. We have all experienced dissection, aneurysm, or aortic valve disease. This isn't just our mission. It's our lived reality and our new normal. So watch for these posts on our Facebook page, here on aortahope.org, on Instagram, and even on LinkedIn under Aortic Hope. It wouldn't be right of me to not tell you about, for Heart Health Month, perhaps you should grab some swag. Wear something that lets people know about aortic disease. We have hoodies, we have sweatshirts, we have long sleeve sweatshirts or 3/4, we have t-shirts, we have all sorts of stuff. We also have the Hope Shop over here with all sorts of goodies with Aortic Hope that may help someone that sees you wearing one of these stop and say, what is that all about? What do you mean aortic hope? I never heard of that. And you can join the education community and tell people about what aortic disease is about, because education is what helps more people be saved and understanding the disease. So you will have a life-saving conversation if you can talk to somebody about that. So you can go to this website here and just order them there. Okay, there's the website, and they get the swag. You put things on your car. We have all sorts of stuff. Plus, all the profits from that do go into our community support. As we're 501c3, and we work only on donations. So this is another great way to donate. Buy some for your family members or whatever. Okay, thank you. It would be amiss if I did not mention our sponsors this week, Cook Medical. They innovate and manufacture quality medical devices to improve lives. We focus on bringing compelling products to market and keeping existing ones relevant. They're located in Bloomington, Indiana, and global manufacturing facilities are worldwide. Edwards Life Sciences is another benefactor of Aortic Hope. It's the global leader of patient-focused medical innovations for structural heart disease and critical care monitoring. You can go to their websites here and see what they do, which is really good. And understand Life Sciences makes devices, and so does Cook Medical, that many of us may have had implanted already if we've had surgery. Also, want you to tell you about Heart Valve Voice US. Heart Valve Voice US, a patient advocacy nonprofit organization, sounds like Aortic Hope, that provides patients with a united voice to improve health for people living with heart valve disease by advocating for early detection, meaningful support, and timely access to appropriate treatment for all affected. Heart Valve Voice works with people living with heart valve disease, clinicians and other experts, and other patient service and advocacy organizations to identify barriers to improving health for people living with valve disease and advocates for change to enhance health. That was a mouthful. Okay. Thank you, Heart Valve Voice US, Edwards, and Cook for supporting Aortic Hope in our very important mission. You too can help. You can be a Hope ambassador. If you'd like to spread hope, awareness, and provide support in your community, you can sign up here. If you want to join the Survivor Series, you can also sign up here at the bottom of the page. And also you can order patient awareness posters, which are great. Those I've gotten some. I take them around to the fire stations for first responders. They hang them on the walls in their break rooms and so on to remind them about that. We put them in hospitals, put them in your doctor's offices and such to remind people to think about aortic disease and think aorta, right? And they're great. They have QR codes to all these things so people can then order books and other materials. Again, at the bottom, donate, 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 and at the top, donate, donate, donate. You can see us also on Facebook, on YouTube, on Instagram, on X, LinkedIn, and then also we have Think Aorta US. And I want to thank you all for joining me today here at Aortic Hope. And I am Rob Seltzer, and thank you again for joining us for the Week in Review.